Thanks for asking me to speak. The big sigh was twofold. The first was follow that, because that was a tour de force in terms of how to run a project, and the way you broke that down into those lessons, absolutely fantastic. So that was the first sigh. The second sigh was for the fact that I've got too many slides because Anton wants me to go quicker. So I'm going to try and do things in that way.
Let's talk faster.
Talk faster. No, that doesn't always get your message across. The beginning. This was when I didn't have so much grey hair. It may not look like I've got grey hair from back there, but I do. We realised that there was a problem. Our students were telling us that they weren't enjoying their course, the curriculum was old-fashioned, and we were in need of change. And I think if I try and draw some parallels with what we just heard, I think one of the key things that you can try and do in these situations is identify a need and then try and communicate that need clearly. And I think what we identified back in 2012, 2011, when we kicked this project off, was that we needed to integrate our curriculum and we needed to better align it with the needs of the service in Wales. And what we came up with was this strapline here, which was to produce excellent clinicians who understand people and the world in which they live and work. And one of my colleagues, Camilla Hawthorne, who's now going to be the Dean of Medical Education down in Swansea University, helped us come up with that. And I'm pleased that she's now back in Wales to help us deliver some of this. So that was the beginning, really. And then there was a bit of a dawning realisation that actually what we were trying to do may not actually meet the needs of Wales based on the emerging information. And this, for me, was one of the seminal documents that really made me and some colleagues wake up to the fact that actually some of the things that we do in undergraduate education can influence what happens in the postgraduate world. And I'm not sure that we were aligned in terms of how we were producing our graduates to actually live, work and sustain the NHS in Wales. And that's really been borne out. I mean, this is data from the GMC from last year now, which really highlights the fact that the middle part of the UK, Wales, Middle England, and over in the east, there is a real shortage of general practitioners. But I think it's more than that. I think it's the fact that it's not about general practice. This is about identifying places in the UK that are underserved in terms of their medical recruitment and in terms of the way in which those populations are underserved, and there are real inadequacies in how we deliver care. The next parallel, and this is something that I do hold dear now, I remember a conversation with CDV Jones, who introduced me to the plan on a page. It was a bit of an alien concept for me at the time, but actually I've stuck with this over the last 4 or 5 years now. And I think what it does, and what it draws parallels to what we just heard, is the fact it actually gets you to concentrate on the important things that you're trying to achieve. And in the interest of time, I'm not going to go around this diagram, but really what it says is that you identify your challenges and you articulate those clearly so that you really know what it is you're trying to address. You look at your desires. What is it that you really want to achieve with this? Then you look at your opportunities. What are your drivers? What are the things that are going to make things different for you? And then what are your products? What is it? What's the vision of the thing that you want to see to be able to produce at the end of the project? And that's what we did with C21. And I was very clear at the beginning of this that C21 was going to be a vision for the students who were coming through it, a vision for the clinicians that were teaching on the course, that we wanted these doctors to be capable to deliver the best quality of care that they could for the NHS. And I'm starting to add that in Wales now, and I think that we'll come back to this, but I think that actually one of the things that I've realised is that actually we need to be a medical school for Wales, not necessarily a medical school in Wales. And then things started to become a bit clearer, and this is an old document now, 1995, but actually it got me thinking about what it means to be a medical school for Wales. And it's about social accountability. And you heard some of this last year when Roger Strasser came over to talk. And I've visited a number of people now around the place that have really embedded this idea of social accountability for me. It's about the fact that actually we are accountable to the people of Wales, both at undergraduate and postgraduate and as clinicians. And actually all of the things that we do should be about delivering better care, better education, and making things better all round for the people. And after all, I live here, you live here, and it's something that really we should be celebrating. And I think some of the things that we realised was that we needed to shift perceptions. And it was the perceptions of you guys, it was the perceptions of our schools, it was the perceptions of our school children that actually Wales, Cardiff, didn't want them as medical students. And that hurt me, that did. And I didn't, it wasn't a deliberate thing that Cardiff did, I don't think. I don't think it was anything that was conscious, if you like. It was a bit subliminal. And we started to see that attrition. You can see here that it doesn't work, but the nadir of our Welsh domicile students back in 2014, 2015, really was a wake-up call for us that we needed to do things differently. And that's where the plan came in, and we actually recognised that really we got to start to concentrate on our widening access, go back to social accountability. We had to think about changes to what we did, and we introduced multiple mini-interviews. We introduced the mentoring scheme where our medical students went out to schools. We partnered up with Swansea University and HEIW. We partnered up with Bangor University. All of these things came together to try and actually grow the ambition, if you like, for our medical school applicants in Wales to want to come and work and study in Wales. Our open day activities are now some of the best in the UK. And actually, I have to give a big thanks to the colleague because they've been a real help to us. The scholarships that they've provided, the ambition around the Welsh language education is starting to show real benefits. And I'm pleased to say now that, based on our on Welsh domicile declarations, we're above 40% Welsh domicile students this year. And I think that's only going to show benefits as the students feed through and hopefully start to raise the number of Welsh domicile students who are going to live and work in the NHS in Wales. And then things really started to align for us. I think that the publication of A Healthier Wales, a whole system approach to health and social care, was beneficial. And again, in the interest of time, I'm not going to go through this. I'm sure you've all seen it. I'm sure you've all read about it. But actually, when I read it myself and I look back at what we did for C21, actually a lot of the rhetoric, a lot of the information that was in that document was already in C21. And we were ahead of the game. We are producing young doctors who should have the skill set to play out a healthier Wales. And it's in its early days, it's in its infancy now, but I can see the benefits when I talk to colleagues around Wales about how some of the things that are happening are starting to have a benefit. And I guess it was at the same time as this was produced, really, that we started to think, well, how can we link the recruitment and retention? How can we be more positive in terms of how we attract students to work in underserved communities? That's both in general practice and secondary care. And the concept of the carer programme, Llwybr Addysg Wledig, or the community and rural education route, came to light. And this is the idea of embedding students in those communities around Wales for an extended period of time. So a whole year, year 3, was going to be delivered in the communities of Aberystwyth and Bangor, with the express sort of intent, if you like, of opening their eyes to those communities, embedding them in projects that are benefiting the communities and reducing the health and social care inequalities that exist. And this is last year's crew, so we've 1 year in now. We've got a cohort of students who have done this, and they've had a fantastic time. The model is based upon a longitudinal integrated clerkship. I've talked to you about this before, but it's all about using some of the techniques that have been in our primary schools for a long, long time. interleaving, spacing, educational theories that allow students to grasp multiple concepts at multiple times without retreating into those silos that we see in my specialty, which is nephrology, and in all of the people sitting in this room. The idea that you can be a generalist, the idea that we do have specialists in primary care who can teach our medical students is one of the dawning realizations, I think, that has been one of the big successes for this program. There was always a concern, are the students going to do as well? Are they going to be the students that we want them to be? And I'm pleased to say on the first year's cohort, they are absolutely that. You may not be able to see these at the back, but effectively on the left-hand side of the panel is the peer group, which is the group of students in the main course. On the right-hand panel is the carer group. You can see that based on progress test data, there is no difference in their performance across the first and the second test. And if we look at things like access and contribution through our logbook type activity, there's no difference in what the two groups of students do. So actually they're achieving the same thing, but from a different perspective. Rather than being in hospital reaching out, they're out of hospital reaching in to see their patients. And the benefits are not only for the students, but actually for our colleagues in general practice as well. There's some things up here that I've put down, but effectively when you read the transcripts down, we're just trying to put this evaluation together. Katie Webb's helping me with it, and Alan Stone and other people. But effectively, it's the effect on the community of practice within individual general practices that's making a difference to those groups. It's building teams, it's getting people to work together to be able to deliver an education program that is beneficial. And what we're hearing is that the students are more likely to want to stay and work in the areas in which we're training them. And I think that's going to have positive benefits when they move on. And the next stage then, I mean, again, you heard about this from Roger last year. So do these type of programs work? Well, absolutely they do. And this is the Northern Ontario data, which effectively combine two universities together to produce a single product that has now left Northern Ontario without any gaps in its training program in a widely dispersed and underserved area. And we've sought to do the same thing. And I'm pleased to report now we have a collaboration between Cardiff University and Bangor University. Swansea are partnering up with Aberystwyth, and we're looking at ways in which we can actually collaborate with our other higher education institutions in Wales to produce some added benefit. And this is the result. This is C21 North Wales, which has launched literally 3-4 weeks ago now. And really this is about innovating to produce a new programme that will address some of the issues that we've got here in Wales. And again, it comes back to some of the articulation. I think before the break you heard about the marketing and the branding, if you like. And I think that's something that we do realise is important. And it is about setting that vision, going back to what we did for C21, the C21 programme, and it's articulating what it is we want to see for this group of students. And it is about community engagement, it is about recruitment and retention, but it's not about GPs. This is about producing doctors who want to work in hospitals, primary care, wherever it is in the underserved communities that we have in Wales. So what we have now, we've got 18 students actually this year, and they are a mix of graduate entry students and year one students, and it's effectively a replication of the course here in Cardiff. What we have stipulated though is that the unique selling point for this course is that the second year of the course, the third year for the main course, if you like, is that it will be a longitudinal integrated clerkship. So rather than having 6 or 7 students out on a carer programme in North Wales, there'll be 20 when it's up and fully running. The third year will be about standard hospital rotations, recognising that these doctors do need to come out and work in hospitals to get through foundation. And then the final year will be about harmonisation and giving them the skill sets to practice medicine rather than just learn from the usual textbook. So what we have now in Wales are multiple pathways in which you can engage with a medical degree. We've got obviously the standard course, the route on the left. We've got the graduate entry course, and then we've got the two courses. One is which you could start in Cardiff and then transfer up to the graduate entry course in Bangor, or go directly into the Bangor route through the established feeder streams that we've got. And I think if we're able to maintain the recruitment of Welsh domicile students, maintain the enthusiasm of the clinicians in North Wales and West Wales, then I think we can start to see a real difference in terms of the improvement in recruitment and retention of the clinicians in North Wales. So if we look ahead, there's a bit more to do, I think. There is a large part of Wales that we aren't able to access very well for our undergraduates at the moment, and that's Powys. Certainly we're thinking ahead about how we might be able to produce a couple of hubs, either in Newtown and Brecon potentially, or Welshpool, and see if we can work on ways in which we can build on some of the innovation that's happening in Powys in terms of the hospital at home, the virtual wards that they've got there. And I visited Montgomery a few weeks ago and heard about some of the things that were happening there, building on the multidisciplinary team, looking at ways in which we can help. And I was reassured really by a review article that was published, I think it was earlier this year, 2 years ago now, that said really that these programs that are designed to deliver set ambitions, if you like, do seem to work and fulfill and live up to their promise. So in terms of achievements then over the last 5-6 years, I think we have achieved a heck of a lot. I think it's been no small undertaking. It's been with the help of all of you sitting down here, listening to me talk year after year with Tom in the early days as Anton Deck, moving on now to where we are now. We've established an integrated course. We've got case-based learning. We are learning in context now. This is about breaking down those silos. So we don't teach physiology, we don't teach anatomy, we teach the two together. And students have a better understanding of how they can integrate that knowledge, if you like, and then apply it in the clinical setting. We have improved preparation for practice, and we have distributed learning. So this is about just taking people out from the centre of Cardiff, very similar to what you've done with the OBS Cymru project. And it's about saying, actually, we've got a huge resource in our back garden that we need to make the most of and use. And ultimately, I think what we've got is integrated clinical learning. So the most recent thing now, I think, is about where we go from here. And I've worked with colleagues in the Centre for Medical Education now. We're 3 years old. We're starting to find our feet in terms of how we interact. And really, we've now set ourselves a strategy. And again, this is perhaps something that I think I've learned over the last 5 years in terms of leadership. It's actually trying to get people to pull in the same direction. And that is really quite hard when you've got a large number of staff that are separated in terms of their physical geography, if you like. And trying to maintain that communication is really quite hard. And what we've set out is a value-based structure here to actually say, well, how are we going to do this? And by what mechanism are we going to do it? And, we've literally launched it in the last 2 or 3 months. And I hope that we'll start to see some benefits of that in terms of our interaction as well. So, I've gone quick. Anton will be pleased. Conclusions. I think we now have a medical school for Wales. I'm pleased with that. I think we've got more to do, and I will push to do more. I think we are socially accountable. Getting there. We are socially accountable, and we are community engaged. And I think that's going to be important for us. I think we are different to England. I think that there are particular things about Wales that we can benefit from and leverage to improve what we do. We are establishing educational continuity. I think there is a call in the postgraduate world for us to put teams back together. I harbour back to the old days, which you shouldn't always do, but I think that is one of the things that we have missed as a profession. And I'm keen to see that develop back in the undergraduate curriculum. I think it will improve well-being for our students, and it will probably improve well-being for our staff. We're evidence-based. And we are trying to actively tackle the needs of the NHS in Wales. And we continue to evaluate to improve what we do. And I'm a big data-driven person, really, and it's hard sometimes trying to interpret some of the data, particularly in a socially driven environment, which is education. And maybe that's the nephrologist in me, I don't know, but it's sometimes it is about the numbers. I think Davith, I don't know whether he's here yet, but I see he's doing a talk or a workshop this afternoon. I think the future for us now is how do we move to the next level. Topol you'll have heard about, all the apocryphal stories of sitting on a plane and all of this stuff. I've tried to read it, and I'm not skilled up to do this, but we do need to skill ourselves. I need to skill myself. You need to skill yourself. We need to be able to address personalised medicine. We need to be able to handle big data and AI. We need to become trained. We need to link better with postgraduate, and we also need to partner with other HEIs in Wales and with HEIW. Thanks, as always. I can't do this alone. The carer crew here, all the people that have helped with the way in which we've developed over the last few years. The faculty in Cardiff, it doesn't include everybody. I pinched this slide from Rian. But they are a hard-working bunch who try their very best to deliver an excellent course for the students. And I'll just leave you with that, which was from David Weatherall. I was digging through some old slides to try and do this, and it struck me that actually that's something that we need to keep in mind. And that's me done. Thank you very much.